So my name's Graham Blench, and I'm one of the counselling team here at the college, based mostly at Peterlee.
Hi, I'm Leslie. I work for the counselling team. Unlike my colleagues, I don't offer counselling. I am a CBT and EMDR therapist.
A lot of people are scared about coming to counselling, or they're apprehensive, and they think they're going to be judged in some way. And that's one of the core skills that we have of being completely non-judgmental. A lot of the first session is about them getting to know me and me getting to know them, because I'm a stranger to them. You know, so we do a bit of information sharing. You know, I might tell them a bit about my family, I might tell them a bit about my pets and so on. It's just to kind of develop this kind of rapport thing that people go on about. And rapport, really, it's just about getting to know each other and to develop a level of trust. And usually after the end of the first session, I always ask the same question at the end of the first session: do you want to come back next week? Generally speaking, they all want to come back the following week. And it's about normalising some of the things that people think are abnormal, and it makes it less scary. That's how it works.
One thing I would say, it's very difficult to get through those doors. The hardest part is admitting you've got a problem, but we are a safe place to talk about your difficulties, and, you know, very good retention rate. You know, myself, once people are in treatment, they usually stay till the end, and we get some really good outcomes. So all I would say is, if you're struggling, you know, just whatever route you choose to bring yourself in, and we'll try and work together to make things better.
In terms of counselling, people have a range of views about what it is, and I'll probably tell you more about what it's not. So I'm not a wise person. And people think counsellors are wise people, and they live on the wise mountain, and they come down every morning with a big bag of wise dust and they sprinkle it on people and all their problems go away. And that's not what it's like. It's more about exploring why people feel uncomfortable or why they're not well. And my role is to help them explore their own issues, not to solve their problems for them. That's not how it works. That's it in a nutshell. How does it work physically? We sit, we talk. I might ask 2 or 3 questions in an entire session, and then we pull the strands together at the end, and then we meet the following week, generally for 6 weeks. Depends. That's how it works. We have a range of kind of skills. We do person-centred counselling, which is like my thing. And person-centred counselling means we don't force the client into a way of working. We're kind of more flexible, and if it's not working for them, then we can change technique, change approach and so on. We'll have my colleague Leslie, who is a CBT specialist, and she'll tell you some more about that in a minute, which is a very specific kind of therapy for some a range of issues that people bring. Basically,
CBT stands for Cognitive Behavioural Therapy. It's recommended by NICE guidelines for common mental health problems, and it can treat a range of anxiety disorders and depression. So basically, in a nutshell, cognitive is how we think, behavioural is how we act, and the emotional side is how we feel. And often all of those things are linked, and often when people come into therapy, they've developed unhelpful coping mechanisms, and we look at that, we look at the links between them all, and we look at alternatives. We very much work in the here and now with CBT, and there's very much an emphasis on its collaboration. There's no magic fairy dust, you know, for me to sprinkle. I think, like my colleague Graham said earlier, we don't make people better. It's a collaborative approach. They're an expert in their own lives, and we know about, obviously, therapy, and it's bringing those knowledge and skills together. And it is very effective. It's an evidence-based treatment. So often, you know, people think, I think there's a misconception that we only deal with the here and now, but we very much look back at somebody's bringing early experiences, maybe traumatic events, to understand why they act, feel and think the way they do now. And we're trying, like I say, adopt more healthier strategies, introduce more healthier strategies. In terms of the EMDR, that stands for Eye Movement Desensitization Reprocessing, and it's a psychotherapy that uses bilateral stimulation, which is we will get a client to look at our fingers and move from side to side, and whilst they're doing that, it's a little bit like REM sleep. It gets the client to learn to process traumatic events. It's used mainly with post-traumatic stress, trauma and some phobias. There's more and more research to say how effective it is.
So people come to the counselling team for a range of issues, from like at one end of the spectrum might be exam anxiety, it might be maths anxiety, which low level, generally speaking, low level anxiety issues which are a big deal for that person. It might be transition from school to here has generated a whole set of kind of issues. At the other end of the spectrum, people self-harm, they cut, they think about ending their lives. There's not a typical kind of client. They come with a massive range of issues, all of which are important to them.
Counselling can be for anyone of any age, from 16 up to 80, 90. I've worked with people, in nursing homes who are still having difficulties, who, they've developed strategies over their life that haven't been particularly helpful to them. Before 16, we would probably see them working with CAMS. And one thing that was really important, that if somebody comes in and they're already working with another service, then we would never double up, because there could be conflict of interest there. So one of the screening questions we ask students is, are you involved with any other services? Because it wouldn't be helpful to be, getting CBT off me and counselling off somebody else, because they're, very different approaches. But yeah, right across the spectrum, and like I say, good outcomes.
Because the team we've got now, we have a really rich range of skills. We're all much of a muchness in terms of our outlook. We work really well as a team. So if one person in the team feels that their mode of working won't work with that client, we have that kind of flexibility to move them on or signpost them onto another colleague.
A big part of what myself, Graham, and the Denise and Tracy, the other members of the team, we offer one-to-one therapy sessions, but also as part of my role and Graham's role, we have been asked to develop a resilience strategy across the college for people who are not in therapy, who are quite mentally well, how to promote good mental health, how to prevent becoming unwell, how to see the signs of when you are becoming unwell, and being able to recognise that. And we are going to spend half a day for Graham and a day for me, and we are going to go across the provision, the Tech Academy, Hoffel and here, and try and get the message out there that it's okay to not be okay, and we need to look at how we stay well. Mindfulness strategies, good sleep techniques, little workshops where people can have a drop in, because one of the hardest areas to reach is the Tech Academy. Because of the industry it's in, a lot of young men don't feel able or equipped to talk about feelings, and I think we need to get the message out that actually we are here. And I think strategies like developing peer relationships, where maybe train some students in noticing and not take on the responsibility, because they're there for the student journey as well, but if they notice a friend is a bit quieter, maybe bringing that to somebody's attention, because it's well documented that suicide is prevalent among young males. It's one of the biggest single killers, so we need to get that message out.
There's a variety of ways of getting in touch with the counselling service. The biggest and the most kind of popular is the progression coaches. We work very closely with the progression coaches. So a referral would go, so I might disclose an issue to my progression coach. The progression coach would they would make a referral directly to the team. You can also self-refer. There's a place on the website where students can just directly self-refer, and I'm currently working with two who directly self-referred. A lecturer or a tutor, they could refer them also. So there's loads of different ways that people can access the service. Counselling
service is based, our main place really is Peterlee, where most of the work happens, but we also have clinics in Hoffel, and we are now reaching out to the Tech Academy. Unfortunately, the Tech Academy have not had this service. They've had to travel over to Peterlee, and they are one of the areas that we do need to do some work around referrals. So at the minute, if anybody needed counselling from the Tech Academy, they would be expected to travel to Peterlee. But in the future, we are hoping to hold workshops, you know, drop-ins.
Sometimes when you're struggling with mental health issues, you know, it's a fairly scary thing and you feel quite isolated. And my kind of message would be, just do it. Just reach out, come to the first session, and if it's not for you, then it's not for you. It might not be for you at that time, but it might be for you at a later time. And we are here. We are here every day of the week to help people. And that's it, really.